So we're here today with Dr. Kirsten Spitz. She is a chiropractor and Apex Chiropractic in Bothell, Washington. Welcome.
Hello, thank you. Thanks for having me.
Thank you. And I want to talk a little bit about how is it that you work with patients in relationship with dental work before or after, and why it is the importance of having a chiropractic adjustment when we are doing some, for example, sleep appliances, or when we're working with the TMJ disorders, when patients are having some issues with their TMJ, some pain, some discomfort, and how what is happening in the mouth affects the rest of the body.
So it kind of depends. It's a patient-to-patient case, right? So first of all, we love seeing people preventatively. So we see people all along their health journey, but for us, it's best when people come in with nothing, because I'm like, oh, there's not really a whole bunch that we need to address, right? But when it comes to people who are about to get work done in their mouth, we look at a few different things. For one, being head tilted back, jaw open in the dental chair is hard on the cervical spine and hard on the TMJ. But we want to make sure that they have the best ability to adapt to what's going on, because we have to deal with those stresses sometimes, right? So say they were going in to get some appliances done and work on the TMJ. Well, the atlas, that first bone in the neck, there's 78 trillion nerve fibers that pass through that bone, and it's so closely related to the TMJ. Then when we look at the cranial bones and the whole upper cervical spine, we have this huge network of fascia and muscles and nerves and blood supply and all that kind of stuff that needs to work together so that we can adapt properly. So we like to see people before and then after care, because we can make sure that their nervous system is set and they're thriving. We never look at people and say, hey, what's wrong with them? We say, what's going on with their nervous system? What's going on with the connection between the brain and the body? And how can we remove any interference that they might have? And then seeing people after that is we can help make them comfortable, right? We can help any interference that happened between holding their mouth open for that long, or now the structure is going to change, right? Because that's the point of doing it, putting like an expander and that kind of stuff in. So what is going to change with their sinuses? Are we going to need to work on their cranial bones? What's going on with their upper cervical spine, but also what's going on with their sacrum? Because if we have tension and all that kind of stuff going on in the upper cervical spine, it is going to affect the rest of the body as well.
Yeah, it is incredible how we see a patient and we need to take a bite registration, meaning like we need to know exactly how they bite down to make sure that we are equilibrating the bite and everything is going to be balanced. But it's a huge difference when we see a patient before a chiropractic adjustment and after a chiropractic. So it is important to see the patient right before we're going to take that bite registration, for example, or we're going to adjust an appliance, to see the chiropractor before that. So we are balancing and adjusting things into the most stable position.
Exactly.
So let's talk a little bit about that connection. You said how many billions of nerve endings are on the atlas?
78 trillion nerve fibers.
It's incredible. And our nervous system is the one that helps us regulate our stress and relaxation, our just the one that is going to help us thrive and react when we need to react. But then at the same time, if we're not activating that parasympathetic, the relaxing nervous system, then all the muscles, all the joints are going to be tight and contracted and tense. But then, so what's happening in the body, and then what's happening at an emotional level?
So are you talking about like when somebody goes in to get their appliance and their TMJ and all that kind of stuff work on?
And in general, when the patients are having the nervous system triggered.
Yeah. So in our office, we like to look at the balance between, like you said, that sympathetic, that fight or flight, or I like to call it the gas pedal, because it just makes it's a lot easier, right? So how's your gas pedal doing? And then we look at that parasympathetic system, because we need to see how that rest and digest or how that brake pedal is doing. We need an equal balance of both. If you are on a hike and you see a bear, you want your pupils to dilate, you want your heart to speed up, all that kind of stuff. But then after, we need that parasympathetic system to come in and kind of reset us so that our body can calm, rest, recuperate, and do all those kinds of things. So through that bone in the neck, well, let's start way back. The nervous system is the first system to form in utero, right? Which I think is so cool, because it starts as the neural tube and then it develops and develops and develops. And mom gives birth to this baby. And then when those nerves pass through, so the nervous system's formed, and then the brain sits at the bottom of the skull in the occiput, and then exits through as the spinal cord, as the brainstem at C1. And then also through there enters the vagus nerve, which I like to tell people the vagus nerve is kind of a buzzword now. People are really starting to learn about it, which I think is so cool because it's so important that everything is properly activated. But if we have misalignments going on there, I always tell people you may come in for back problems, or you may come in because your gut is being affected. And even though your low back is what your problem area is, sometimes you may only get a neck adjustment that day. It just depends, because we do different analysis to make sure that your system is fully functioning. After we do these tests, like we do heart rate variability that lets us see the balance between the sympathetic and the parasympathetic system. And it's really nice because we can see, okay, if it's a typical patient coming in, like say it's a newborn, everyone thinks, well, newborn, there can't be really anything going on, right? But we have to think about, okay, well, what was mom doing before she was conceiving? Was she stressed about conceiving? Well, what happened while she was pregnant? Did she have a really happy, really relaxed pregnancy? Or was she stressed about work? And was she stressed about the other kids? Or was her husband deployed? We've had some families where their husbands were in the military, right? And so they were gone a lot of the pregnancy. They didn't know if they're going to make it back. And then what happened during the birth process? Did they feel respected and empowered? And did it go the way they wanted? Or do they have all these different epigenetic components that are kind of affecting them? So then we look at the baby, and then a baby comes out, and we can see babies who are colicky, which I don't like to call that a diagnosis. I really think that that's like a blanket we throw on babies, right? But a colicky baby, a lot of the times, unaddressed, can turn into a kid with ear infections, and then a kid who can't sit still in class and has ADD, ADHD. Mm-hmm. But what happened physiologically and in their nervous system? I think when we were talking before, we talked about how there's been dental research that when you guys are able to help fix the palate and the structure of the maxilla and mandible, that these kids that are struggling with things like ADHD are completely resolved, which
Correct.
is so
yes.
cool.
It is amazing. It's amazing how we can transform that. The patients can breathe better. It's just a complete change of individual.
Yeah.
And I love what you just said about how a baby that's supposed to be like completely healthy, depending on what was happening during the pregnancy, what were the emotions that the mother was experiencing, can come in results and consequences for the baby after the delivery, or even during the delivery. And this is something that I'm fascinated with what you do, that you are able to work not only with babies when after they're born, but even before they're born.
So when we see a mom, we're working on mom. So we're not really working on baby, but mom's nervous system and baby's nervous system are connected, right? Through that, people think, oh, it's just the cord with the cord blood, but that's what's connecting mom's nervous system to baby's nervous system. So when we make sure mom's nervous system is free of interference, so she's not struggling. I mean, we all have stresses, right? Physical, so stepping off a curb wrong, emotional, any kind of stress. And then that environmental, which there's so many different things on a day-to-day that we come in contact with. What fragrances are in your house? What kind of food are you eating? Where do you work? Like all of that kind of stuff. But so and our body's good at adapting to that until it's not, right? It's kind of like we hit this threshold where our body says, no, I can't adapt to this anymore. And that's when we start to see symptoms. But a lot of times it's like just the tip of the iceberg, right? So we like to make sure mom's nervous system is free of interference. And then we go in and we make sure that she can move the way that she's supposed to. So we want to look at the biomechanics of the pelvis, because the way that the sacrum and the pubic bone and the uterus are structured, there's so interwebbed connection. And so if we make sure that mom is free of interference and that she is able to move the way that she's supposed to, then baby is able to move too. I like to explain it. I don't have a balloon here, but we'll use a rubber band. So pretend this is like the uterus and the sacrum's pulled back. Well, then it's going to pull on part of that round ligament, right? And so there's tension. And then you're like, well, I want the baby to go head down because that's how I need to deliver a baby. And they're not able to do so, not because the baby at that point needs adjusted, but because mom needs free of interference in order to be able to give the baby the space to move and do the things that it needs to do to go head down.
And this is how I just saw a picture of a mother that was pregnant and the belly looked smaller. And after the adjustment, it looked more room for the baby. So how do you do things like that? What is the physiology? How are you changing things in the mother when they're pregnant?
Yeah. So we married two different analysis with pregnant moms. So we do something called torque release technique, which is a tonal analysis that lets us we actually use the Achilles reflex to see where there's interference in mom's body. So we do that first and foremost. And then what a lot of people know for chiropractic for in pregnancy is called the Webster technique. So the Webster technique is actually an analysis that is anyone that has sacral issues can benefit from. But specifically with pregnant moms, we add in other components like round ligament, working on the round ligaments, working on the psoas muscle, that kind of stuff. So if you came in, I would do my analysis, see where there was restriction in the sacrum, correct the restriction, work on the sacrotuberous ligament, which goes right from the tailbone to the butt bone. And so we release both of those. And then a lot of times after that, moms can already feel a difference. But then we do something called a piriformis sweep. So the piriformis is that fusiform muscle right on the glutes. And we release those because it's really important. That's that forward downward pressure that mom has. It kind of pulls everything down, which can create that anterior tilt in the pelvis. And then we turn mom over and we release those round ligaments, which is really just a gentle, when I say release, I'm saying we're either doing a motion or it's like a gentle, at this point, it feels just like a small sustained contact, waiting for that round ligament to release. And then we address the psoas muscle. So the psoas connects to every bone in the low back, and then it goes down through the hip. So it's our main hip flexor. So people who sit in a chair all day long at work, or even people who stand for long times, periods of time, like a barista or someone who works at a bank or someone who does hair, that muscle is used to being in one position for so long that it can start to get kind of angry. And so we need to correct the neurology that controls that muscle, but then we also need to go in and manually release the muscle. And then when we do that, the uterus is able to move, mom's able to take a deeper breath. And then instead of having a baby in a ball like this, well, now there's so much more room. And so they're going to move and shift. And a lot of times I like to tell moms that babies give us high fives while we're adjusting them because they'll start kicking and moving. But so that's kind of how we address it. And then it's so fun to be able to see mom get up and say, oh, I can breathe better. Or, oh my gosh, my belly looks so much bigger than it did before I came in.
It is incredible. And then it's not only with just the space and for the baby, but also after they're born, then you're doing some manipulation, some balancing and adjustment of the atlas, for example. And then just so the baby is going to start maybe breastfeeding better. What are the benefits of doing that for babies?
So when we see a baby, I like to see babies within the first 2 weeks postpartum. I will obviously see them anytime, but for our current pregnant moms, I like to say I want to see you and your baby within the first 2 weeks. For mom, the center of gravity changed immediately, right? After you had 10 months to accumulate this new belly, and then it changes immediately. But for babies, we want to make sure, like I said, they're thriving. So when we go through the vaginal canal, we have the cranial molding that happens. And then when the chest goes through, it kind of starts that ejection of whatever they might have in their mouth and all that kind of stuff. It's really stimulate that first nervous system stimulation outside the womb. And so in a completely normal natural delivery, there can be 60 to 90 pounds of pressure on a baby's head and neck between the force of contraction and pulling and twisting. And then we talk about if a baby had to get vacuum or forceps or anything like that. And there's so much neurology that goes on in the cranial bones. And so a lot of times then we'll see kids who have off-shapen heads, so plagiocephaly, and they'll develop a torticollis. Well, when they have a torticollis, they can't turn to one side. So now they're struggling to latch, and mom's struggling with supply. And then you have this time that's supposed to be so amazing, but it's stressful for both mom and baby. Baby's hungry, mom's stressed, she can't feed the baby. So we like to see babies to make sure that their nervous system is fully functioning from the get-go. Because like I said, we picture, oh, there can't be anything going on, but that's just in a vaginal birth. And then we talk about cesareans, which depending on the provider and the conditions and what's going on, is an emergency C-section, is it a planned C-section? That can be up to a whiplash on a baby, depending. So it's just a lot on their system and they're so little. And so I always tell people, adjusting a baby isn't adjusting a little human, it's adjusting a developing system. And so it is so different and it's so gentle. But so we can see increased ability to latch, to efficiently withdraw milk from mom. We can see better digestion. I always like to say if baby's not eating, sleeping, pooping, there's something going on, because that's all they should be doing for the first little bit. I had a mom recently, and she brought her baby in, and she said, is there ever a time where they're just quiet and relaxed? And I was like, yes, like it can happen and it will happen, and it might take a little bit of time, but absolutely. And so being able to walk through those times with mom is really cool. And a lot of times we'll get messages, my baby blew out in the car seat. And I'm like, we celebrate that. That's amazing. I'm so sorry you have extra laundry to do, but that is so awesome. And they're going to be so happy and sleep so much better.
It is incredible. And one of the most important things for babies and for the development of their oral feature or the oral cavity is just to be breastfeeding, because that's how they learn. Like they need to position the tongue in the right place to be able to guide the growth of the maxilla, and then just allow the movement of the mandible. And then so the TMJ will benefit from it, and then the growth definitely will benefit from it. So we can prevent like a narrow arch in the future. We can prevent a lot of problems down the road by having a normal breastfeeding. Mm-hmm. So this is great. So before and after is super important to do the chiropractic work. Have you noticed changes at an emotional level when you do your adjustments, when you do your treatment with mothers or even with kids?
Yeah, with both. So we have on our update form, so we do new scans and we do a one-on-one check-in every 12 visits in our office, because it's really important. Yes, I want you feeling better, but I want you functioning better. That's my biggest goal, is you to be able to function. So whether it's a grandpa who wants to be able to play golf and pick up his grandkids, or a mom who is trying to grow a human, it's really important that we do that. So there are different adjustments that can create more emotion in people. And sometimes if people are going through a big emotional thing, we will actually adjust less because we don't want to overstimulate their system. But we've seen people who couldn't drive to their appointments because they had such extreme anxiety be able to drive, no longer have to Uber to their appointments, which is so cool. We've seen moms who are on anxiety meds be able to either lower those meds or wean off of them, which I think is so awesome, because there's a time and a place for everything. But obviously there's no mom that's like, I want to be on this forever. And so that's really amazing. And then energy levels, even I tell people, just because you're pregnant doesn't mean you have to be in pain and tired all the time. That's a sign that there's something else going on, right? Obviously you are utilizing more calories and you are utilizing more energy, but you still should be able to function and feel good. So yeah, we do see that. And then with babies, most recently, well, there's two babies that come to mind. One, mom had baby's 2 weeks old right now. Mom had appendicitis at 34 weeks pregnant. And so she had her appendix out, right? So that's a big surgery anyways. I always think it's so funny when people are like, oh, it's just a appendectomy, or, oh, it's just a C-section. I'm like, no, this is a big thing physically and emotionally and environmentally, because we're having to put meds in you, right? But so that happened, and then ended up going into labor. But baby's heart was not doing well, and so ended with a C-section. And she has an 18-month-old, and she was like, they're so different. Like this new baby, she's like, he's so fussy. He's really struggling to latch. He's not pooping very often. He's not doing all those things. And I was like, well, let's back up and think about how awesome it is that you guys are both even trying to latch and you're trying to do all those things, and you brought him here. And it's not because you did anything wrong during your pregnancy, but you had a lot of stuff. Like and during the pregnancy at like their 8-week scan or their 12-week scan, they found out the baby had a VSD. So then they were stressed about that. So those are so many different stresses. So we have to walk through, okay, let's talk about this stress. It was a surprise pregnancy. And then you found out that the baby might have a heart problem. And then you had to have a major surgery. And then you had a cesarean, which you weren't planning for. So that's a lot.
Too many things, too many stimulus for the poor baby.
Yeah. So we did the scan, and this baby's nervous system, I mean, the sympathetic and parasympathetic system are under normal operation. So we look at the different scans, and we look at different things. And after the first adjustment, they weren't able to come back in for another week. And typically we'll see these babies back to back because there's just a lot going on. And she's like, he did really good for the first day. But then there's it's back. And I said, yeah, well, it's only been one time. And there's a lot that think about, I remember all these things. So I like to just remember and encourage, like, that's amazing that after one adjustment, he was pooping better already, but also now we still have to work on this. And then for boys, we have to think about, are they going through a circumcision? Because that's a procedure. Are they getting ties done? What ties are they getting done? What severity, what class were they? And so all that kind of stuff. But long story.
When we're talking about ties, for people to understand, it will be the tongue tie, that little tissue that connects the tongue to the floor of the mouth. That's because sometimes it's very tight, it's really close. The babies are not allowed or not able to breastfeed correctly. So it is necessary to do it when they're that young. So that's so for people to understand.
Yeah. And so but then they came back, and so we put them on 3 times a week, and he had his 3rd adjustment yesterday, and I said, how is the week going? And she said, it was so amazing. He gave me 3-hour stretches. He nursed for 20 minutes straight without popping off, and he pooped so many times that I had a lot of laundry to do because he was blowing it out. And I was like, that is amazing. And being able, for a new mom with 2 kids, being able to sleep a 3-hour stretch is like, the 3-hour stretch makes such a difference.
Oh yes, it is huge. It is so amazing.
Yeah.
So what do you recommend for someone that is not either pregnant or not a baby? So someone that is feeling okay, because a lot of the times we feel okay, but there's some changes in our body that are causing, for example, the TMJ problems. We have seen that there is a huge connection when the patients are they're having problems with their shoulders, with their neck, and then with their hips. You were talking about how the hips are important for pregnant women, but also if we're having issues with our hips or our shoulders, it will reflect with the TMJ or on the TMJ, and our occlusion is going to change.
Yeah. Well, just like we were both talking about, it's all connected, right? So 78 trillion nerve fibers through this bone, one single fiber connects to coccyx, to the tailbone. And so if we are so wound up all the way through, what's happening? And so a lot of times people will come in, and TMJ could be their only issue. They're like, I don't know what to do. I've done all this other stuff, and my TMJ is bothering me. And I say, okay, well, let's look at the rest of the system. Let's look at what's going on. And sometimes on the 1st or 2nd adjustment, we will address the TMJ, but a lot of times before that, we're clearing spinal interference, because if we can clear the spinal interference, then the body is able to process all that nociception, the cranial nerves coming out, right? All of those things. And so if the body's able to do that, and then they're still having problems, okay, well, let's look at biomechanically what's going on. And there's different analysis for TMJ. But a lot of that too is, there's a huge emotional tie to upper cervical spine and TMJ, and headaches, migraines, right? Grinding. So we'll have people who just experienced a death or are going through a big work change, and it's not always bad stress, but a lot of times it's just, our assistant was getting married last year, and her shoulder was flared up more than it had been since she started working for us. But they planned a wedding in like 6 weeks, and it was beautiful, but it was stressful.
Of course. Wow. So what are the recommendations for people for after they see you for doing the maintenance, just making sure that their body is going to be in balance, and then just also maybe you have some recommendations for regulating those emotions?
Yeah. Well, most people who come into our office go through corrective care first. So corrective care could be anywhere from like 4 weeks to 6 months, to even to a year, depending on the person. And then after that, making sure that we're maintaining, it's kind of, you wouldn't get braces and then never wear the retainer, or a lot of people have, right? And then they have issues.
They move back.
Like, those are bones also. Those are things that we have to address. And so I like to explain it a lot of times like braces. When you get your braces on, if you don't have that much going on, you don't have to wear them that long. But you may think there's not a lot going on, but then when your orthodontist or your dentist gets in there, starts looking, they're like, no, there's this tooth is really big back here. This one is twisted in the socket. There's so much going on. And the same things can happen with the vertebra, and those are important. But the reason I care about what your vertebrae are doing is because it's protecting your spinal cord. So we do corrective care, and then we graduate people to maintenance, which is really fun. I always tell people, I love seeing you multiple times a week, but I don't want to see you multiple times a week forever, because I want to be able to see other people and help them, and you to be able to feel like you can go live your life. Or if you're going on vacation for a month, not be worried that you're going to have this flare up. So other things that people can do aside from chiropractic is making sure that they're eating whole foods, right? They're minimizing their environmental exposure. People always tell me I'm crazy. I'm like, there's not fragrance in our house. We don't have any chemicals. Like, all of those things matter, and things in moderation. If my kids go to a birthday party, they're going to have cupcakes that probably have all the things in them, and that's okay. But I'm also equipping them to make sure that they're able to adapt and handle that. Walking outside, getting fresh air, walking outside barefoot. People meditate, pray, do all those kinds of things. Stuff to bring yourself center, because I think that we live in such a fast society that we forget until we're really sick or really hurt that, oh, I do have to make some deposits into my health.
That is true. Well, thank you so much. This is so helpful information. Do you have any last things you want to say, how people can find you?
Yeah. So, the easiest way to access this right now is our social media. So at Apex Chiropractic WA. Our website, you can definitely always reach us on there, but it's going through a big transition right now, so it hasn't been updated since we opened in 2019. So that will be coming out soon. But social media or emailing us at apexchiropracticwa@gmail.com. You can always give us a phone call, and we're pretty accessible. We try to get back to people within 24 to 48 business hours. If it doesn't happen, to shoot us another message, but it's really rare that people slip through the cracks.
Well, thank you so much. And I highly recommend everybody to go and have an appointment, because it is very important, not only for the whole body, but just to start balancing every single joint, and you'll have side benefits at your emotional level.
Yes. All right. Well, thank you so much for having me.
Thank you. Thank you so much.